Hello and welcome to another episode of Home Care Hot Seat. Today I'm joined by Lee Williams, the Chief Technology Officer at Radar Healthcare, a leading software company that supports care providers across quality compliance, client safety and risk management to improve their CQC ratings. Okay, so could you explain in simple terms how Radar Healthcare works?
Yeah, so it's a cloud-based system. So there's no requirements for any hosting for the actual client. We host everything. It's a web-based system, so all you need to access the system is a browser. Google Chrome or one of our supported browsers, and we support most of the browsers available. So we're not saying you have to use a specific browser, because we understand that different organizations will have different browsers that they use. It works on any device, so it's device agnostic. It can work on a mobile phone, it can work on an iPad, it can work on a workstation, and it will render on all of those. So it means it is truly mobile. So you don't need to download an app or anything like that. It's literally just within the browser, and that can be used on any device. And there's kind of key areas that it covers. So it covers some of the main features that the CQC are looking for. It covers a lot of things that people are generally doing with paper and Excel and emails, and it's streamlining a lot of those processes. So it's looking at things like, what do we do and how do we manage and how do we evidence how we manage an incident? So an incident happens, this is what our policy says should happen, and then we implement that policy within the system. So we say, well, okay, the first step is somebody reports an incident. The second step is there is some kind of investigation. There might be some notifications that are required to regulators, whether that's a CQC or whether it's reporting locally to safeguarding. And then there's some action planning. So how do we make sure this incident doesn't happen again? And then there's some learning. And so there's some learning on an incident to make sure, again, that there's learning shared throughout the organisation. So if you're thinking about the CQC regulations, that kind of covers those key areas that they're looking for, how you manage an incident. What we don't do is say this is how you should manage an incident. So we have lots of templates that we use, whether it's for complaint, freedom of information, an incident. We have these templates and we work through those, and they're obviously best practice templates. What we allow our clients to do is to configure the system to meet their procedures and their policies. So we don't have a fixed system. It's all workflow based, so we can build workflows to meet their policies and their processes. So that's kind of one angle. So looking at what we call them events, but it's incidents, it's complaints, it's subject access requests, all of those things where there's some initial piece of information gathered and then there's some defined follow-up actions. We then kind of look at how organisations assess themselves against quality frameworks. Again, an organisation should have a quality framework in place that says how they do their own self-assessment. And then we allow those audits to be run within the system. So the digital audits, but the key thing that come out of those audits is every time I can't fully evidence one of those checks within an audit, I have to create an action plan. So that's the big outcome really of the audits. And we see that with a lot of clients and a lot of people we speak to. People are generally quite good at doing those audits. What they're not particularly good at is making sure the actions that come out of it are completed. So a big part of the system is the action planning. Right. So we do all those incidents tracking. We do the auditing. We also do the action planning that comes out of those. We can track CQC improvement actions. We can track health and safety notifications. All of those things that we need to do and that we need to be able to evidence that we're doing correctly, we can do within the system. We then go on to other areas of quality and compliance, looking at document management. So how do we track our policies and make sure they're all in date and make sure that they're reviewed correctly? And again, that we can evidence all of this. How do we make sure that our workforce are trained and that we're tracking their compliance and that we're tracking their compliance against DBS checks? All of those different workforce compliance checks can be done within the system. And again, because it's done within the system and all of those things are done within the system, we then have analytics that sits over the top of it. So we're then able to, in real time, be able to look at trends. So we're not looking at trends at the end of the month and probably 10 days after the end of the month when it's taken us time to compile all of that data, which again is kind of normal because people will wait till the end of the month, get all of that information together, put it into some kind of Excel and then create some charts. By the time you do that, something that you could have actually made an intervention to much earlier, you couldn't do because you didn't have the data. with real-time analytics, what that's doing is allowing you to make those interventions quicker. So if you can see a trend of falls for particular types of service users, you can do something at that point in time. You don't have to wait until kind of 10 days after the month end.
Right.
And then the other part that we look at, which I would say isn't something we come across a lot within care at home or many social care sectors really, but you certainly see it within the NHS, is risk management. So having a fully defined risk register with controls in place, and tracking that risk and tracking the trend of that risk is something, again, that happens a lot within NHS organisations and larger private organisations, but not so much in the smaller ones. And we think that's a key improvement area for a lot of these organisations, because again, it's not something that they do a lot of. So having a fully developed risk register, again, within the system, tracking all of the actions that come out of that is a key outcome of the system.
Okay. Could you tell me specifically how you support home care providers to manage risk and improve outcomes?
Yeah, again, it's all of those areas. So if you think of a home care provider, they've obviously got an office somewhere or multiple offices, depending on the size of the organisation, and then they've got carers out going into people's homes. So as these carers are going out into people's homes, there's obviously things happening when they're in those homes. So there might be recording incidents. They might be doing quality audits while they're there. They might be looking at actions. All of that obviously comes into the system, and then people sat in the office can actually then manage those processes through to looking at, as the example of an incident, looking at the kind of the notifications. So if there's a notification required, that can be managed. If there's action planning, that can be managed. If there's lessons learned around that incident, that can be disseminated out to the workforce using the system to say, look, we've seen a trend of these types of incidents happening. This is what we're going to put in place to stop this happening again. So if you think of somebody who is a branch manager, they will then get oversight of all of that information about their branch. So does my workforce have all of the checks and training in place that I require them to have? Can I see all of the incidents that have happened and the complaints that have maybe come in? So a complaint would generally come into the office, and that can be then managed through the process. And again, matching the policy. So you're then tracking that complaint through. If you've then got a head office that sits over all of those branches, they can then get oversight of what's happening at each branch. So you then get that oversight of right from kind of the top level right down to then there might be a regional level, again with branches that sit under that, again depending on the size of the organisation. It's that oversight that you get with a system like ours that allows you to see what's happening. And if I can see a trend occurring in one branch, why isn't that happening in other branches? And what are they doing differently to these other branches? And then being able to then implement something to say, well, we've reviewed what's happening in this branch, whether that's good practice or bad practice. I can then create actions for all of the other branches to either make sure this isn't happening in your branch, or actually this is happening elsewhere and it's good practice. So let's implement that good practice throughout the rest of the branches. So really, when we're talking about home care, it's about that person who's in the person's home delivering the care, having the system being able to report those things in real time. So there's been an incident, that then being alerting to the relevant people within the branch and maybe higher up. And then it's that oversight of somebody who manages a branch, somebody who manages a group of branches, somebody who manages the whole organisation. And the permissions within the system define what each user can see and do.
Okay. You spoke about incidents there. Could your technology potentially be integrated with things like assistive technology and sensors and things like that?
Yes, definitely. Yeah. So that's one of the things that we're currently looking at. And obviously there's a big push at the moment for IoT devices as well. So whether that IoT device is, there's something, I seen one the other day, which was all about, well, actually, if everybody's going to have smart meters in the home, actually we could see if there's been a drop in usage, which means that somebody hasn't been up, they've not been putting the kettle on, they've not been firing up the boiler, whatever it is, that could then trigger something, because it's just a device, and that device can then trigger things within another system. So one of our key things going forward is how we integrate, not only just with other systems, but how we integrate with things like IoT devices.
Yeah, okay. So how does Radar Healthcare differ to other home care software solutions on the market?
Yeah, I think a lot of the other solutions that we come across are focused around kind of the care notes area. So this is the care that I've given to this person within the home, or it's kind of rostering. So how we scheduling those visits to people in the home, and obviously the invoicing and everything else that sits behind that. We don't generally see a lot of systems out there that do the things that we do. So they're not looking at kind of safety and risk and quality. So although those might be outcomes, if you think of what you would do with Radar, we would be looking at one of those systems to have a look at, well, actually, has the care been delivered? Is the quality of care as expected? Is the quality of the notes that have been created as expected? And that would be an audit, for example, that would be done within Radar, and we would be then checking the effectiveness of the person that's delivering that care and how they're recording that information, because it's all about evidence in what you do. That's what the CQC are looking for. They're looking for evidence of that you are providing a safe, well-led service throughout the whole of the key lines of inquiry. Everything has to be evidence-based. So even if that person is out there providing great care, if you can't evidence it and you can't prove that you're checking the effectiveness of that care and the safety of that care, then you may as well not provided the care. You have to be able to evidence it. And I think that's the key thing. And again, evidence in that you're actually looking at the quality of what's being provided.
Okay. Which home care providers have you worked with? And could you give me some real life examples of how you've helped improve their businesses and help them meet those regulations?
Yeah, so we work with a range of providers in care at home. So we work with Claremont Health, who are a private mental health support at home. So we're not just kind of looking at the one specific sector. We work with HRM Healthcare up in Scotland, which are a well-known provider. Quite a lot of our clients seem to have a mix of different provider types. So we have Care South, who have not only care homes, but they also provide care at home. We work with the Guinness Partnership that have a range of services, one of those being, I think they have 7 care at home areas, but they also have extra care schemes and supported living. So those are kind of the people that we work with. We generally find that there seems to be a growth area around a lot of people that are providing care homes and now starting to look at, well, actually, how do we provide a care at home service as well?
Absolutely.
And I think it will end up kind of vice versa as well. I think care at home will then look, well, actually, is there different services that we can provide to make it more of an integrated system? So they're examples of projects that we've worked with and clients we've worked with. And they will all be slightly different, and there'll be different reasons that they have that they're using Radar. So as an example, Claremont were using a lot of their quality and compliance was done using email, Excel. They didn't have a system, so they had a system, but it wasn't an electronic system. So all of the incidents, complaints, all of those things were done using email and Excel. So what we've managed to do is digitize all of those processes, and then with the analytics that sits over the top of it, again, it's giving them that real-time view. And they're a fast-growing company. So what we're finding is, again, is people are putting these systems in place because they know they've got fairly they're looking to grow significantly over the next kind of 1 to 2 years. And actually, what we generally find is that is when the pain point starts to hit. So it might be okay if you're a fairly small business and you're not providing a lot of hours of care to actually do all of this using Excel, because you're not going to have lots of incidents and complaints. Once you start growing, that becomes an issue, because it becomes much more difficult to manage. And that's where systems like ours really start to provide that value. And then when you get to the point where you're getting multiple offices or branches, you then get that top-down approach, which then gives you even more value. So that was an example of one of our clients. Another client of ours, the Guinness Partnership. So they, again, work across different sectors. They had a very specific requirement for tracking safeguarding. So they started off just by tracking safeguarding notifications through the system. And we built a workflow with them. So they designed a workflow. This is our process for tracking safeguarding. And now we're rolling out auditing and other features within Radar for them. So people will do it differently. Some people will say, well, actually, we don't have anything, so let's do all of the features of Radar. And some will say, well, actually, we've got a very specific outcome that we need to track, whether that's safeguarding or whether it's we just need to do incidents and complaints, or whether we just want to do risk registers and audits. So it's a modular system, and it will depend on the client, really.
Right, so they can have different packages and pick and choose what they want to do.
Exactly, yeah. We generally find that 80% of our clients, it will be, well, actually, we need all of this. But some will have, as I say, some will have very specific outcomes that they're trying to achieve. And we can focus on those areas. All depends on the client, really.
Okay. So can you tell me about some of the biggest challenges you faced? Obviously, you weren't in health or social care before, so that must have been a challenge.
Yes. Yeah, I think that probably when we were starting up, that was probably one of the biggest challenges. But we partnered with some kind of industry experts that helped us define and understand health and social care. And I think the biggest challenge for any business is, I think, is making sure it's a sustainable business. So you need to make sure that your staff are happy, they're engaged, they're supported, and they're challenged. Because if you don't have that within your workforce, then you're not going to have great customer experience. So it has to be all about how do you attract staff, how do you keep your staff and keep them supported and challenged. I think that's the biggest challenge for any growing business, because you don't have years and years of growth behind you. You may not have a HR department. You don't have lots of things that people are used to be working in larger businesses. You don't have as a growing business. Obviously, now we're much more. We've been around for much longer. We have lots more of those things in place. But certainly, when you're starting out and in a tech business, there isn't those kind of things there. So it's making sure that you employ the right people with the right skills. And I say once you have them, it's again making sure that you keep hold of them. Because we're all about how do we provide the best customer experience, and whether that's, you can have a great product, if you don't have great people supporting that product, then it's not a great customer experience, and vice versa. You could have great people but not a great product, you're still not going to get a great customer experience. So everything that we do is all about that customer experience. So looking at the product, looking at how we support the customer.
Okay. How has the pandemic affected your business?
In terms of how we operate, very little, because we were always a fairly dynamic company anyway, and that although we had an office, and we still have an office, people were never in the office 100% of the time. So obviously we've got people that are out on the road and live in different areas of the country that will only ever came into the office for meetings. All of our development is done in the UK, so we don't outsource any development to outside of the UK. We get contractors now and again within the UK, but 90% of all of our development is done by our in-house developers and test team. It's all supported from within the UK. So the pandemic didn't really impact us that much. People do just work from home much more than they used to, and we haven't had that face-to-face contact. In terms of our clients, what we had to do was very quickly spin up some new features within the system to help them track COVID. So whether that was in the early stages, tracking staff, because staffing was one of the biggest issues. So actually track staff that are symptomatic or not symptomatic, track whether they could get a test, because in the early days there obviously wasn't lots of tests around. So tracking that whole process to say, well, actually, we can see an issue coming here, that we've got people that are reporting in that are sick, or people that have reported in that somebody within their family has been tested positive or has symptoms, and so having to isolate. And I think that was probably the biggest challenge for every provider across the whole of the health and social care. So we quickly span up some COVID trackers, which allowed our clients to track staff and the impact of COVID. We also managed to spin up things in terms of how we track the service users in terms of COVID, because obviously that was another area where we would need to, our clients needed to know whether the people that they were supporting had a positive test, or whether they were awaiting a test back, because then they need to change the care and the way they delivered that care. So that was kind of in the early days of the pandemic. And then obviously since kind of November last year, it's been about how do we track the vaccinations? Again, tracking vaccinations, the first and the second, for staff and for the service users again. And again, being able to see that in real time has been really valuable. So being able to see, well, actually, we can see a spike coming here of staff that are going to be off because they're isolating. We can see they're going to, and we know they're going to be isolating for 2 weeks or whatever it might be. You can then start planning ahead, and you don't need to be managing all of that with Excel, because the system does it all for you.
Okay, so can you then collate that data and then use it to learn lessons going forward from the pandemic, for instance?
Yeah, I think every tech provider will learn lessons from the pandemic. I think where we were fairly fortunate is that to actually spin things up in a lot of area of our system, so to create a COVID tracker, wasn't actually a massive piece of work. We didn't need developers to do it because it's such a configurable system. We could actually get our clients, we built templates and said, actually, these are the templates that we built for these COVID trackers, and the clients can change them themselves. So we have something called Form Builder, so they could actually change those COVID tracking forms themselves. So it allowed, if we hadn't had that, it would have meant that it had been a big impact on our service delivery for all of our clients, because everybody would have been doing these COVID trackers. So I think that's the biggest change for us and for all of our clients, is making sure that you can actually react really quickly, because I think it all kind of came very quickly to everybody. And yeah, we were fairly fortunate in that we were able to spin things up fairly quickly, because it was a massive benefit to our clients. And I think the other thing is that, like any other businesses, again, how do you keep your staff engaged when everybody is working 100% remotely? And there's also been lots of other issues where childcare, which again I was one of those people with a 2-year-old and a 7-year-old at home. How do you manage that and manage work? So flexible hours, which we already had anyway, became even more of a requirement. Certainly for us to support our clients properly, was just making sure that we could keep our staff engaged, making sure that they were safe, making sure that they had the things that they need to do to be able to perform their job. And again, we were fairly lucky in that it was something that we were already doing anyway to a certain degree, in terms of home working.
Many technology companies have told me that they've seen an uptick in demand from home care providers wanting this kind of technology particularly since the pandemic. Have you witnessed that as well?
Yeah, I think it's just really highlighted the benefit of having tech for any health and social care provider, and actually any kind of business in the UK. It's actually shown how much benefit good technology can bring, and the home care sector is no different really. And we're certainly seeing an increase in people, certainly people that are now starting to think more about cloud systems. So obviously there's quite a few systems out there that are not cloud-based, which don't work well when with home working and remote working. What we're seeing is a lot of the systems that are cloud-based getting some really good traction, because it is a massive benefit. There isn't that overhead of having to have your own servers. You don't need to manage the servers. We do that. We're the experts at that. So you're the experts at providing the care. We're the experts at providing the host and the technology. I think if you try and mix the two, that's when it become problematic. So I think certainly an uptick in demand. And what we're also seeing is actually people to really think about, how do we integrate these systems together? So when 5 years ago, a few of our clients we were doing integrations for. Now probably 50% of our clients are understanding the benefits of being able to integrate data. So something very simple as, having single sign-on. So we can provide a single sign-on into our system, which means that using Active Directory, you can log into the system, and that it can be done over a mobile device as well. It basically means that I only have one password to manage, which, although you think that actually sounds, well, that sounds quite small, actually to an end user, that's massive. I only have one password that I need to think about to access 3, 4, 5 different systems. If I have 5 different passwords, which all change in different time periods, it becomes really difficult to manage, and actually can become a bit of a security risk, because then they will write those passwords down to remember them. So it's simple things in terms of integration that I think will have a massive impact and a massive benefit. So we're very much for how do we join up all of these systems, not just within social care, but then how do you join it up to CCGs, and how do you join it up to trusts?
Yeah. Okay. And how have you seen the regulatory landscape evolve since you started at the company, and where do you see it heading in the future?
Yeah, I think there's 2 different areas that I think certainly the CQC have changed. They're now much more focused on the person that's receiving the care. So they do a lot more around speaking to the service users, speaking to the people that are receiving the care, to what do they think of the service, because that is the most important part of it. The second part we're seeing is that there is a lot of focus now around tech, and I think that's only going to grow. So if I'm a provider, wouldn't it be great if the things that the CQC come in and check, so I'd come in and show me how you manage risk, show me how you manage your risk assessments within your organisation. Well, actually, if we could do that remotely and give them access to the system to have a lockdown version of that, wouldn't that be great? So they don't actually need to come in and do all of that. Or actually, wouldn't it be great if, as soon as a particular type of incident is recorded, that can be sent off to the CQC? Why can't we do that? Because that happens with trusts. So there's a new system that's replacing what's called the NRLS for NHS, which is a project called PSIMS, which basically means as soon as an incident is reported into a trust's risk management system, that automatically gets sent up to NHS Improvement. Why can't we do that in social care? So there's all of those kind of things where we're doing CQC notifications. Wouldn't it be great if actually we could click a button and it automatically gets uploaded to the CQC, and then actually, as the CQC review it, we're getting feedback without it coming in lots of different emails and everything else. Having these systems that can talk to each other can make it much easier for the providers, but also for the regulators.
A couple of years ago, I went to a conference, a digital social care conference, and some providers there were saying that CQC inspectors still want to see paper reports, despite all this, the technology that they're integrating to make everything safer, etc.
Yeah.
Do you think that that's still happening, or is that improving now?
I don't think it happens as much. I think providers are much more able to say, no, sorry, we've got a system here which is much better than paper, that we're going to show you instead. And there's no reason why the regulator shouldn't accept that as good and even better evidence than paper. So it's not something that I think, yes, years ago, I think people were used to seeing paper, getting out big files of paperwork, running through that. Well, actually, it's much easier for me to sit in front of a system and say, here's the last 12 months worth of health and safety audits, than actually having to go to a folder, pick that out and have a folder that's kind of this big with all of my health and safety audits in. It must be better for the regulator to be able to see, well, actually, this is the system, this is the data. And obviously one of the big things as well with a system, you can't change data within the system. There is always an audit trail. So if somebody changes something, the system logs that. Paper, obviously that is much more difficult to track. So actually it makes it a much safer system. It also makes the kind of data governance much easier as well. So obviously there's been big changes over the last few years in terms of GDPR and data and how we store data. all of these systems that you'll see in for care in the home have all been through that process. We'll all be registered with the ICO. We all do GDPR audits internally and make sure that that data is safe. That data is much safer sitting in a system sat behind online protection than it is sat in a folder.
Yeah, absolutely. And obviously it's important now that everything's, you know, on a cloud or online because of the virtual inspections that have been happening as well.
Exactly. Yeah. It makes it much easier. Certainly, yeah. Virtual inspections, having a cloud-based system makes it far easier. And it's been interesting how the basics of tech have taken off through the pandemic. So there'll have been lots of people that didn't really have access to anything that have now got access to technology that's helping them deliver better care, and that's what it's all about, really. So it's the simple things. There'll be many more people that work in care now that have an email address that didn't previously, as a simple way of communicating. There'll be many more people that have mobile devices, and so I think that's probably the biggest change, and probably those smaller changes will have the bigger impact. So people having access to technology and systems will definitely have a big impact.
Yeah, I think that was predicted at the start of the pandemic, actually, that technology would have one of the biggest impacts, and it seems to have turned out that way, actually. So
yeah, I think if you look at kind of the prevalence of all these different online meetings tools, so whether it's Teams, which has been rolled out across the whole of the NHS, or whether you're looking at Zoom or GoToMeeting, there's so many of them. And I think that's been a massive change. Some of it has been will 100% stay because it's been a massive benefit. Some of it will obviously get wound down a bit because you do need that face-to-face contact. But yeah, I think some of those smaller changes and access to technology that probably wasn't there before. People have invested in better hardware. So they've invested in better mobile devices. They've invested in many more laptops than they used to have, which now means we do have a mobile workforce where maybe 18 months ago we didn't.
So what are your plans for Radar Healthcare post-pandemic?
I think for us, it's that whole integrated care piece. So I say we work across the whole of health and social care. I think over the next few years, how we integrate care from primary, secondary, care homes, care in the home, ambulance, how do we integrate all of that information together to make it seamless? So there's been lots of work happening around kind of the shared care record. So I have a system that's looking at the care we're providing for a person in their own home. I can now see within that system, I can see their GP notes, for example, and that's a massive impact for those. Well, actually, wouldn't it be great if we're, as a CCG that's commissioning a service, wouldn't it be great if I could see how that service is performing? Wouldn't it be great if actually particular types of incidents could automatically be sent up to the CCG? So there's lots of ways that we can integrate this data to make it a much easier ecosystem to manage all of this information, and at the end of the day, again, make that care better for the person who's receiving it and make it safer.
So what are your long-term ambitions for the company? You talked a bit about assistive technology. Is there anything else that you've got lined up?
Yeah, so we're looking at the moment a lot around predictive analytics. So your standard analytics is this has happened. We can see data from an hour ago or yesterday right back to 3 or 4, 5, 10 years. And that's great, that's showing us trends. Actually, what is out there at the moment and what our analytics will allow you to do is to predict. So it will allow you to predict what's going to happen to that trend based on the data within the system. So when I'm talking about being able to benchmark data and look at trends, actually, if we had data from lots of different providers, we would be able to give a much better prediction, because with any AI and machine learning, the more data you have, the better learning that machine's going to have. So if you're thinking about, take falls as an example, if we had falls data across a whole region or across the whole of the UK, wouldn't it be great to be able to predict, well, actually, we can see our trends. Actually, what could we predict based on what's happening elsewhere, and what can the machine learning within the analytics predict? So being able to pull all of that information together and actually then predict what's going to happen in a week, a month, a year's time, I think that will have a massive impact. And certainly when we're speaking to some of the larger providers, that's something that they're certainly looking at as something in the future will become a big thing, because people are now starting to collect more and more of this information. If we can pull it together and we can pull data from different systems together, it will give us a much clearer picture of actually what has happened and what we can actually predict is going to happen in the future.